So I'd like to take this opportunity to welcome each and every one of you from all the continents, from all the regions and the countries, and also the villages represented on this webinar. What an opportunity to share, learn, and change things for children, making them better together. Thank you also to Transforming Children's Care Global Collaborative Platform. For those of you that are new and learning more about the platform and the webinars that we're hosting, the overall vision of the collaborative platform is to establish more strategic-wide collaboration, spanning the global to the local and inclusive of a wider range of stakeholders. Its aim is to enable organizations like yours, like all of ours, to engage in child protection and care reform, and most importantly, agree on common principles and building on each other's work, so that we can secure a greater and more sustainable impact and contribute to shared learning, and also to undertake joint advocacy. This particular collaboration is already ongoing with active participation from all actors involved in children's care. And one of the ways is through a number of working groups. So a reminder that today's webinar, the 8th in the series of the Transforming Children's Care Global Collaborative Platform, has been organized by members of the Transition Working Group, but developed collaboratively with partners to share learning and tools with input from a number of actors and agencies. Not everyone is represented in here today, but everybody was involved. Today's agenda, very quickly, we will start off with an introduction and a demo of the digital transition framework, and in particular, the transition tool, followed by our panel agencies and their representatives, who will share key themes and emerging issues from their experience in transitioning in Mexico, in India, Cambodia, and Uganda. I will then ask them some questions and then open up for Q&A from all of us. Folks, without further ado, I'd like to introduce Rebecca, our first speaker today. Rebecca is the Senior Technical Advisor for the Better Care Network. She has 22 years experience working in the international development and care reform sector. Her focus is on transitioning residential care institutions and curtailing drivers of institutionalization, including orphanage tourism and foreign funding. Rebecca is also the co-founder and chair and co-chair of Rethink Orphanages Australia and co-convener of the Australian Council for International Development's Child Rights Community of Practice. Welcome, Rebecca.
Thank you so much, Christopher, for that introduction. And thank you, everybody, for joining us today. We're very excited to be able to share some of the outputs of the residential care, the transition working group with you today, that, as Christopher shared, has really been a wonderful collaborative effort by all of the members of the working group. So the Transitioning Residential Care Services Working Group commenced with the objective of promoting and scaling up good practice in the transition of residential care services and improving collaboration and coordination between organisations who are supporting residential care services to transition. And when we started this working group and this collaboration, we realised that as a sector, we didn't really have clear or a consensus-based position on what transition was or what it entailed, or how to break it down and how to talk about the different aspects of a transition process. And so different organisations were using the term transition to refer to different things. Some were using it to refer to the reintegration of children, and others were using it in a narrow sense to refer to perhaps one stage or one aspect of transition rather than the whole process. And so we were finding that this was creating confusion, especially for organisations who were considering undergoing a transition of their service, who didn't yet have visibility of what was ahead of them. And so this was creating barriers to collaboration, challenges with coordinating technical support, and it was preventing the sector from being able to build that body of evidence and knowledge that we need to build in order to articulate what good practice is. So as a working group, we decided to start by developing a consensus-based, open source framework for transition that could help resolve some of these barriers and act as a scaffolding, if you like, upon which we could build that learning and evidence and develop referral networks to be able to better access technical support and to also develop tools and resources as they're identified as necessary. And so a key piece of this framework was this diagram that you can see in front of you here, the phases of transition interactive diagram. And the process of developing this diagram collaboratively really allowed us to build that consensus that was missing. The end product of developing this was that we have, as a sector, an interactive diagram that can give everybody visibility of all the different things that can happen in a residential care service transition, including directors, donors, key staff, supporters, technical support organisations, and of course, governments. I'm going to walk you through some of the key features of this tool. And the main graphic here gives you a high-level overview of transition, and it's a bit like a roadmap. And it takes you on a journey along this line here as transition is broken down into phases and then into stages underneath each phase that are signposted by these circles along the line. But it doesn't try to present you with a fixed approach to transition or a model per se. And the reason why is that we recognize that there are very varied contexts in which transition is taking place, and those contexts need to inform the strategy or the approach that is taken. However, in almost all cases, transition will work through these very broad phases and stages, sometimes out of order and sometimes in an overlapping manner. Now, phase one here is all about learning and exploration, and it deals with understanding the reasons for the shifts away from residential care. And it breaks down into 3 stages: building awareness for the reasons for change, exploring the local context for transition, and identifying and engaging with others, which is about trying to identify who else is involved in transition work in that area or that country, and how you might be able to tap into other support networks to help with the transition process. Phase 2 is about preparing for transition, and it deals a lot with assessments and developing the approach to transition. And it breaks down into 5 stages: organizational assessments, which is about getting that baseline understanding of readiness and the starting point of the transition; making links to the National Child Protection and Care System, which is about making sure the transition is connected to the broader care reforms happening in that country versus operating in a silo; and then developing the strategic plan, getting buy-in from the key decision makers to implement a transition, but also to implement the strategic plan that's been developed; and then governance and organizational strengthening and capacity building, which is about really getting the organization ready and making sure that the infrastructure is there to support a safe and effective transition. Stage 3 is then about implementing the transition, and it first offers you 2 distinct pathways that reflect different outcomes in transition. The first is full transition to non-residential services, and pathway B is for safe closure and reintegration of children, or for divestment of resources if you are a donor or a volunteer sending agency that is using this diagram. And here you can select which one of these pathways is relevant to you and represents the journey that you or your partner find yourself on. And then you can follow the stages below. Next, these pathways break down into 2 levels. And the first level groups together the stages that relate to the organizational change processes. And the second level groups together stages that relate to social work or reintegration and case management. Now, these 2 levels are not linear, and in most cases, aspects of them are going to be outworked at the same time. Now, each stage that is featured in this roadmap is a link that you can click on to access deeper dive information about that stage. So let's look at one for an example. We'll go up to phase 1 and look at stage 2 here, exploring the local context for transition. So for each stage, you'll have information about the aims of that stage, key processes or actions that may need to take place throughout that stage, and then key milestones. There is also at the bottom here a resources link, and this is about accessing resources that have been specifically identified that might help you understand some of the key processes or actions that are listed in this stage, or they might be tools that will help you with the implementation of those actions. And as new resources are developed, we can continually link those to this diagram so that it is an evolving toolkit. Now, when you're exploring the deeper dive content, you can also navigate forwards and backwards throughout the stages using these buttons at the bottom here. You can also see exactly where you are in the overall transition journey by seeing which one of the circles here is colored in on the main diagram. You can use this side panel here to navigate throughout the whole tool. So you can expand on each of those phases and then click into any of those stages that you want to, or you can use this button at the top here to get back to the main diagram. I'm going to stop screen sharing and let Margot share the slides with us again, and just very quickly end by showing you how to access the tool and where it lives in the BCN library. So you can see here, this is a screenshot of, on the left, the BCN library, and you'll see circled there, it says Transition Hub. That is one way to get into this Transition Hub graphic on the right of the screen, and then circled there, you can see the entry point into the phases of transition diagram. We can go to the next slide. And just ending with this one to show you, also we have organizational profiles that you can access, and they're also found in the Transition Hub. And you can do that by clicking on the organizational tab, and it can then allow you to look for organizations who are working in transition so that you can actually facilitate referrals and connect with others who are also in this line of work. So I'm going to hand back now to Christopher, who's going to introduce another one of the tools that is a key part of this transition framework. Thank you.
Thank you very much, Rebecca. And thank you to everyone who's just joined us. It was intentional for me not to introduce myself at the beginning, so I will now. My name is Christopher Mwanguzi, and I work with Child's Eye Foundation in Uganda. Thank you to everybody that's introducing themselves in the chat group. Please continue to do so. And for those of you wondering how you can follow this, you can also look in the chat. My colleague has posted a link. Allow me now to introduce our next speaker, Hannah. Hannah Wan. Hannah is the senior technical consultant for Connected, ACCIR's Global Care Reform Initiative, and has 20 years of experience working with vulnerable children and their families in Southeast Asia and the United States. In her role with Connected, she provides technical support to practitioners engaged in deinstitutionalization projects within Asia and Africa. She also supports directors, caregiver staff, and donors of privately run institutions through the transition process. Hannah holds a Master's of Science in Education with specialization in early childhood. Welcome, Hannah.
Thank you, Christopher, for that introduction. So to give a bit of context to how the tool came about, when you're working in the transition space and you visit so many institutions, you start to notice patterns. For example, when there's a photo of the founder up on the wall, or when you hear the children call the director mom or dad, or when you're working with donors and they tell you that they don't care what the research says because it's best to make decisions with your heart. So then we asked ourselves, is there a way to analyze those patterns to predict how any given transition might play out? What kinds of things could indicate a strong likelihood of success or potential obstacles? What kinds of things indicate serious risk that could put children at further harm if you move forward with transition? Next slide, please, Margot. when it comes to who holds the most influence over the decision-making of an institution, and therefore how a transition might play out in contexts where the government is mostly hands-off, there are two primary stakeholders, the director and the principal donor, who can either be the main fundraiser or represent the main donor. So the focus of this assessment tool is on these three areas. Number one, the director. Number two, the principal donor. And number three, the partnership between them. Next slide, please. We've used a traffic light system to categorize the indicators observed in those three areas, with green indicating low risk, orange for medium risk, and red for high risk, with the level of risk determining the feasibility of a successful transition or a safe closure. Next slide, please. So the primary target audience and context for this tool is practitioners who are providing technical support for the transition of institutions that are privately run, largely overseas funded, and located in countries with weak regulatory frameworks. So this tool is not an interview guide. It's not something to hand over to directors or donors for them to complete. Instead, it's designed to help you as a practitioner gather the information you need to identify the risks that can impact a transition and to help you design strategies to reduce that risk. Next slide, please. The tool should be used during phase 2 of the phases of transition, which Rebecca just covered, as part of the preparation stage. So in phase 1, as you're interacting with and observing the director and the donor and their partnership, you would be collecting the information you need to then complete this tool in phase 2. So now if we can go to the online tool, please, Margot. I'll give a quick demonstration. And lastly, in addition to the organizational assessments in this step, it's also critical to look at the cultural practices of the local context, as that will factor into your overall assessment of the transition.
Here you have an overview of the tool in both video and written format. And these sections go through the details of what I've just covered, including a list of resources. If you click here, that will take you to the assessment. And here on the left, you can see the 7 themes that we've identified as most relevant to transition. And you can click to jump from theme to theme. The training video explains what the theme is about and how it impacts transition. And it includes a video case study that features practitioners that share how that particular theme played out in their own transition experience. There's a written description, which in theme 1 covers different communication strategies to make the case for transition. And the indicators will take you through a list of green, orange, and red light indicators that can help you identify where your particular transition sits for that theme. Here, in an example of a transition I supported, I ticked mostly green light indicators for the director, as he had a background in working with children prior to his director role, and he was hired into his position. For the donor, on the other hand, I selected mainly orange light indicators, as his background was in finance. He was the founder of the institution, and he established the institution in memory of his daughter. Now, this doesn't mean that any of these orange light indicators are necessarily negative. It just highlights the possibility that the standard approach to making the case for transition in theme 1 here, which often relies on logic and the best interest of children, may not be effective with a donor who ticks these kinds of indicators. Because this donor's involvement in the institution was for an emotional reason, an emotional appeal was likely to be more effective in convincing him to transition. Next, if you click on the score button, it tallies the number of indicators you selected and gives you an overall rating of green, orange, or red light for theme 1. That pulls up a set of implications that correspond to your light rating, which in this case includes an explanation of why an emotional appeal might be more effective. There are some concrete suggested actions, which are broken down into the 3 phases of transition: phase 1, phase 2, phase 3. And there are some funding implications that describe how the budget might be impacted. If you click here, you can see examples of green, orange, and red light indicators in 3 real case studies. And if you click here, you can see the full case studies, which we recommend reading before starting the tool. So if you go back here and work your way through the remaining themes and complete all of the indicator checklists, your scores for each theme will then be incorporated into an overall scoring and light category rating for the entire transition, whether green, orange, or red. It gives you an overall summary of the potential risks and how you can plan to mitigate them. And if you click here, you can download a PDF of all of your results across the entire tool, and you can also go back and change your indicators as you collect more information.
So to review, this tool is meant to be used within phase 2 of the phases of transition, and it is primarily for practitioners supporting the transition of private institutions. The tool highlights the themes that impact a transition and helps you make sense of the information that you gather against those themes so that you can determine the level of readiness and risk of a particular institution and therefore the feasibility of safe transition or closure. And now I'll hand it back over to you, Chris.
Thank you very much, Hannah. Once again, I hope everybody was able to follow that. And reminder that in the chat, we have placed a link to the tool, the transition tool, so you can go in there and have a look at it as well. Thank you very much, Hannah. Welcome to everybody that's just joining and those who joined during that conversation. A reminder that this webinar will be recorded and is being conducted in English with Spanish translation. Margot, if I could ask you to bring up that slide really quickly. So if you have just joined, remember to click and for translation and make sure that you're in the right channel. The next section will have English and Spanish speakers. So I want to just make sure that everybody is following and in the right channel with us. So just a reminder to click on the right channel as we follow on to the next section. So a little reminder that this particular webinar, the 8th in the series from the Transforming Children's Care Global Collaborative Platform, has been organized by members of the Transition Working Group. And it's been developed collaboratively with partners to share learning and tools with input from a number of actors and agencies. Not everyone is represented on the call today, and not everyone will present, but a number of people in the background have worked to make this possible. So there is the fantastic, thanks. So folks, join me in welcoming Sister Celia. Sister Celia is currently the coordinator of the Office of Mission Development in Mexico. She is a member of the Congregation of Our Lady of Charity of Good Shepherd. Sister Celia, I invite you to make your presentation. Thank you.
Muchas gracias por esta invitación a compartir con ustedes el camino que hemos iniciado en México. Nosotras, movidas por las iniciativas que la congregación a nivel internacional viene desarrollando para implementar las mejores prácticas y el enfoque de derechos en la misión que realizamos, hemos emprendido este camino hace ya cerca de 5 años que hemos trabajado más intensamente en estos procesos de transición. La siguiente. Vamos a ver. Somos una congregación que estamos en 72 países, en los 5 continentes, y en México estamos desde 1900. A lo largo de los años hemos ido viviendo la transformación, respondiendo a las circunstancias, respondiendo a cada época en la que se nos van presentando diferentes desafíos. Y actualmente en México estamos cambiando nuestro modelo de atención en 5 casas hogar. Las más antiguas de estas 5 casas tienen 120 años de existencia. Y estamos fundamentando esta decisión partiendo de las directrices congregacionales, conscientes de que somos parte de un proceso global, y esto nos ha llevado varios años de planeación, discernimiento, búsqueda, y gracias a Dios hemos encontrado esa vinculación con asociaciones, instituciones que están trabajando para favorecer estos procesos de cambio. Vamos a la siguiente. Queremos abordar este cambio a través del fortalecimiento familiar. Somos conscientes de que los niños, niñas, adolescentes tienen derecho a crecer dentro de su entorno familiar o un entorno protector y acogedor. Y si podemos evitar que sean separados de manera innecesaria de su familia, vamos a trabajar para ello. Estamos impulsadas porque la congregación ha venido cambiando en los diferentes países. Hemos trabajado con niños por muchos años, ya que la congregación nació en 1641. Pero conforme va pasando el tiempo, hemos analizado la realidad y esto nos ha llevado a decir, vamos a responder de diferente manera. En este momento estamos trabajando juntamente con la iniciativa Cambiando la Forma en que Cuidamos, y ha sido una experiencia muy valiosa porque hemos experimentado el profesionalismo, la experiencia, la escucha y el respeto que han tenido para llevarnos en este proceso de cambio. Vamos a la siguiente, en el que compartiré cuáles han sido los pasos que ya estamos dando en esta transición. A consecuencia de la pandemia, las niñas y adolescentes regresaron a sus hogares con su familia. Podría decirles que esta experiencia de pandemia vino a darnos ese pequeño empujón que necesitábamos para darnos cuenta de que las niñas podían vivir desde su entorno familiar, podían salir adelante. Quizá hubiésemos tardado más tiempo en decidirnos si la pandemia no nos hubiese empujado. Y es por este motivo que 2 de nuestras casas ya han transitado a un nuevo modelo de atención y 3 de ellas aún estamos en discernimiento. De esas 3 casas, solamente una continúa acogiendo un grupo reducido de niñas. Y en la casa de Tijuana, Baja California, que es un lugar de frontera, en el que por más de 60 años veníamos acompañando a niñas, jóvenes y adolescentes, ahora hemos transformado nuestro modelo de atención para abrirnos a un hogar, a un centro comunitario que atiende a niños y niñas de una colonia muy pobre que está muy cercana a nuestra casa y que la podemos ver en la primera imagen, en esa fotografía. Es un barrio con muchas carencias en todos los sentidos, económicas, de infraestructura, de situaciones también emocionales y familiares que requieren mucho acompañamiento. Y nos hemos lanzado en ese nuevo desafío de contactar, de entrar en relación con estas personas y de atender a los niños y a las niñas desde ese entorno en el que ellos viven. Y en la casa de Ciudad Juárez, que también es una ciudad de frontera, donde la situación de personas en movilidad humana es desbordante, donde han aumentado mucho el número de mujeres que emigran con sus hijos menores de edad. Aprovechamos las instalaciones de nuestra casa, que eran muy grandes, para abrir un albergue temporal para estas mujeres que llegan a la frontera acompañadas de niños y niñas menores de edad. Esto ha significado un gran desafío para nosotras porque estamos aprendiendo nuevas maneras de servir, de acompañar, de promover a las mujeres, a sus hijos, sin que sean separados de su entorno familiar. Muchas gracias por este espacio en el que puedo compartir que es una experiencia desafiante y al mismo tiempo una experiencia que nos está dejando grandes aprendizajes en lo que hemos venido realizando. Muchas gracias.
Thank you very much, Sister Celia from Mexico. That was amazing and very useful. Isn't it amazing to be able to hear real life examples, but also to have a tool that we can use to work through it? A reminder to you all that in this section, I am going to invite our panelists to talk about their organizations and the work they're doing. I will then ask them a series of questions each. And then at the end of that, I will invite you to ask some questions. In the meantime, should you have questions for Rebecca, Hannah, or Sister Celia, please place them in the Q&A section, not in the chat, but in the Q&A section, so that we can pick them up really quickly. Thank you so much again, Sister Celia. That was amazing. I look forward to speaking to you again. I am now going to go to our next panelist. Our next panelist is Kusum from Miracle in India, Miracle Foundation. Kusum has worked in the development sector for the past 23 years, with varied experience in education, livelihood, gender, and rights. She has been part of a senior leadership of large international and national nonprofits in India, helping to build sustainable development models that work at scale. Ladies and gentlemen, we invite Kusum.
Thank you, Christopher. Namaste and hello to everyone joining in from the different parts of the world. I represent today Miracle Foundation's work that focuses on use of technology and making evidence-based decisions to effectively transition children from institutional care to families in 11 states in India and in the US. Our three-pronged strategy around prevention, transition, and support looks at building family and community systems that ensure that children stay with families and that they have the right support to grow up into strong, productive individuals. I'm glad to be here and will be presenting our learnings from the work with institution partners and their journey to transition into a non-residential care system. As a quick background, after focusing for a long time on improving standards of care in institutions and then on transitioning children to families, it became really clear to us that we had to work with institutions first and their leadership to rethink the entire institutional care framework to be able to break this cycle. If you can go next. With this in mind, what we did is we launched a pilot with 2 of our institutional partners in 2019, who were identified after a period of a year of doing inspirational dialogues with 17 of our partners, which was across the entire organization with their teams, with their founders, as well as their boards, to see who had the right mindset and interest, as we saw earlier, which is critical to make effective transition, to focus on the transitioning process. With the aim to build their capacity to make that shift from being a childcare institution to being something else, we started work with them. And at that point, we really did not have a clear goal of who they would become, though there was a broad direction. As we worked with both the organizations, it became really clear that this did not mean only working on their vision. It also meant that we had to build along with them very closely the organization's capabilities to withstand this change process. This also meant that we were co-designing programs with them on what a family-based care system would look like, give them access to funding support for the new design that we built together. And we also had to ensure that we work with their teams, knowing fully well that their livelihood and their skill set was linked very closely to the previous model. It meant reworking with the teams of their KRAs, their skilling gaps, and working with them to make that transition effectively. It also meant that we were working with the larger ecosystem. The existing donors of the partners that we were working with, they had to be sensitized of what this meant, that suddenly we were making a shift from being an institution to something else, and also to work with governments to ensure that there is a sustainable and systemic way to adapt to a family care system. This we did very effectively, and at the end of 2 years, one of our partners, Aram, made that shift and has currently transitioned all children that they had to families and are focusing very strongly on prevention models, ensuring that children are caught on early and they don't land up in the institutions in the first place. And I would really like to mention that a lot of the credit for this goes to the founder of Aram, this partner, who himself is a visionary and was very strongly leading this process at every step. We worked and we continue to work intensively with Aram. The other partner that we worked with during this pilot phase transitioned most children back to families, but decided that it wasn't time yet for them to make that shift to being a completely non-institutional care organization, and we continue to work with them. This is very briefly the journey. If you go to the next slide, you will see the steps that we took that I spoke about and the key learnings that we had. Thank you for this space. Very glad to share the work that we have done, and really look forward to more sharing and learning from everyone. Thank you.
Thank you very much, Kusum. That was really, really useful. Thank you so much. A reminder, folks, that we will have a Q&A session for everybody at the end of the 2 sections. So the first section, the panelists are talking through their work. I will then ask them some questions, but would love to hear from you. So please post as many questions as you can in the Q&A section. Thank you so much, Kusum. I look forward to coming back and speaking to you again. So we now move on to Uganda, from Mexico to India to Uganda. Amazing examples that will hopefully broaden our thinking and our thoughts and our understanding of transition, and a tool that we can use. I'd like to welcome Evelyn. Evelyn is a passionate, experienced social worker and trainer. She's the project manager for Child's Eye Foundation's Tororo Deinstitutionalization Project. She oversees 4 social workers who currently work alongside a network of over 100 community volunteers, as well as youth well-being champions that have led the way for transformation, a district free of orphanages in Tororo in eastern Uganda. Evelyn has worked for Child's Eye Foundation since 2015, where she joined as a social worker. She has 8 years experience of social work practice with a focus on alternative care, deinstitutionalization, capacity development, and case management. Welcome, Evelyn.
Thank you very much, Christopher. Next slide, please. I'll be giving a background of Malaika Babies Home. This is an institution, a residential care facility that was established in 2009 with a 25-bed home run by Child's Eye Foundation. This is just a brief background. Basically, the home was set up to offer and provide quality temporary care for abandoned babies while we carry out tracing, reintegration, and adoption. We considered this as the best model, as we had 90% of the children placed back in families. And unfortunately, it was not the right thing. It was not the best option for children. Some children, we were running the adoption campaign together with the government of Uganda. And for children where we failed to find a biological family or relatives, they were placed up for domestic adoption. Basically, we wanted to combat long-term institutionalization and ensure that all children grow up in a family setting. But unfortunately, this didn't happen. For some children, they had to stay long in residential care because we had children who needed special medical attention. We had children with disabilities, and it gave us difficulty in placing them back in family. Next slide, please. Looking at our process, we had to set up strategies. We had a communication strategy that was put in place. It was to communicate to our stakeholders and also to our donors. So we scaled back in 2014 to 2016. We scaled back from a 25-bed facility to an 8-bed facility. But unfortunately, it was not cost effective because even if we had 8 beds in place to take in children, we still were incurring costs of rent since the premises were not belonging to Child's Eye, and also were still paying for the carers. Even if we had 8 children within the home, we still had to pay for the total number of staff that were there. So it was not cost effective. So another strategy that we put in place was a recruitment strategy where we are able to recruit our carers to become foster parents. So the funds that were spent on rent were divided to foster care and strengthening family, while children are placed with foster carers within the community. We also had to explore the legal and policy mechanisms in place to replace residential care. Initially, Child's Eye Foundation had worked with the government of Uganda in developing the alternative care framework, but unfortunately, there were no alternative care guidelines in place. So it was difficult for us to understand exactly what we are doing, and the government didn't have proper foster care guidelines in place. There were no legal procedures concerning foster care. So as Child's Eye, it was difficult for us to monitor and supervise the carers because we had courts placing care orders with the foster carers, and it was difficult for us as Child's Eye to monitor and supervise. So we vetted the baby's home, carers. They became foster parents. We were able to set up new policies. These policies, we had the child protection policy within our human resource department, where the carers were able to sign, so that we are able to see what was happening within the community. Next slide, please. Looking at our learning and practice when it comes to transition, it is very important to have political will. It's very important to have the government on your side to help you transition. Not only the government, other different stakeholders within the community in order to enable the transition move on smoothly. And also, transition can take a while. You don't have to rush it, and you don't have to leave anyone behind. Every child is independent. Every child is an individual, should be considered independently. Every employee we are working with is an individual. We should listen to everyone and take it step by step. And then to build a network around your transition, it's very important to work with the community. Very many people in the community are willing to give a hand. So it's very important to get the community involved and not feel like you're doing this on your own. I guess that's it from me. Back to you, Christopher. Thank you very much.
Thank you very much, Evelyn. Thank you so much for presenting that and for sharing your experience in Uganda. So I will look forward to speaking to you again later. Folks, a reminder that we're putting some of the links about the work from the previous panelists in the chat. So if you want to look at those links, please go to the chat and look at them. Don't be distracted. We've got more to come and more to listen to. Excuse me. So we're now going to Cambodia. I'd like to introduce my colleague, Lo. He's the head of child protection of the FCF REACT, Family Care First Responsive and Effective Child Welfare System Transformation of Save the Children. He has worked with a variety of beneficiaries and stakeholders for almost a decade in the field of psychosocial and mental health after he graduated from a BA in psychology and prior to pursuing his master's in social work in the United States. Lo has since been providing consultancy services to various agencies, including local NGOs, UN, government, and to universities. Lo's expertise includes training and supervision, case management, individual family group counseling, and so much more. I'd like to welcome Lo and his presentation. Thank you.
Good evening from Cambodia, and thank you, Christopher, for very sweet introduction. It is my great honor to represent FCF REACT for this important opportunity, presenting our lesson learned on RCI transition in Cambodia. Next slide, just a brief introduction of around 60 organizations working together to support children in Cambodia to ensure they care in the safe and nurturing family-based care. Our learning experience related to transition is the importance of working together with the national government of Cambodia, including national and subnational system to support their way of transition. So I'd like to share some of the experience we are working with the government and the partner organization to support RCI who are willing to transition from their model to the family and community-based care. And recently we have conducted a study, and it is interesting finding out that the respondent revealed that the fact that the government set a clear policy on the care reform and also put in place the mechanism of practice and support is putting a clear message and direct you to encourage and strong minimum standard inspection of the residential care for children. Just a little bit background. After realizing that residential care was still a dominant care in the country, so we worked together with the government and development partner to set policy and action plan. And the study found out that this is very important and putting a pressure for the transition and closure of the RCI. But as the previous speaker, Rebecca and Hannah have said, transition involve many factors in the processing. Another key important is also working together with the government to support the RCI to do the transition, because after realizing that the negative consequences of residential care for children, importance of family-based care, and the strong encouragement and support for transition, those who are willing may have difficulty to processing. So mechanism of support, working together, setting strategy of support has been very important to support the RCI for the transition. So together we are doing the awareness raising, training to RCI, to key duty bearer, NGO and the government duty bearer, as well as promotion and support the mechanism for family strengthening, increasing of alternative family-based care for children, as well as the support for reintegration, reunification of children back to the family and community. And these have been a successful experience in our transforming experience in the country. Thank you very much. This is a short presentation. If you have any question, I'll be happy to answer.
Thank you very much, Lo. And thank you so much for giving us that detail. We heard you very well after that. Thank you.
Thank you.
So folks, we're running a little bit over time, but I would like to make sure that we bring our panelists back for some quick questions and then open the floor if we need to. So I'll start with Sister Celia. Sister Celia, can you hear me?
Sí.
Fantastic. Okay, just give me a second. Here we go. Okay. So Sister Celia, thank you for your presentation. Could you please share with us the experience of you and the other sisters in terms of the emotional journey that has been part of the transition? How have you addressed those emotions, and why? Why was that important part of the process?
Sí. Para nosotras, esto ha significado un proceso de duelo, el saber que estamos cambiando. Y somos una congregación con 84 miembros aquí en México, y nuestro motivo por el cual muchas ingresamos a esta organización fue porque era atrayente lo que hacíamos, el cuidado de niñas, dedicar nuestra vida, dar todo nuestro amor a esas niñas y todos los cuidados que requerían. Y en este momento para muchas es una incomprensión de por qué lo vamos a dejar, sobre todo las más mayores que tienen 50 años, 60 años dedicadas al cuidado de las niñas. Y como todo proceso, es estar siempre recordando el por qué lo estamos haciendo, el que ya ha sido un acuerdo, el que vamos en este camino juntas y cada una a su paso va comprendiendo, va sumándose, va apostando por lo que estamos realizando. Y como todo proceso requiere la escucha paciente y la escucha con todos los sentidos y el respeto por cada una de los miembros y la comprensión en muchos de los casos a lo que cada una vamos experimentando al asumir este proceso de cambio.
I couldn't agree more. I could not agree more. What a powerful and very clear message. Thank you so much, Sister Celia. I'm sure other people will have more questions about that emotional journey, and I will let them ask them, but thank you for your time. I'll now go to Kusum in India. Kusum, can you hear me?
Yes, I can. Yes.
Fantastic. Can you explain the importance of supporting CCIs to create a vision for alternate or non-residential services in order to help them make a decision to fully transition? How did Miracle approach this via the Envisioning Exercise? And just for those, CCIs are childcare institutions. Could you tell us a bit more about that, Kusum?
Thanks, Christopher. This is a great question. Thanks, Margot. So can you go to the next slide? Just the next one. If you see that the process of transitioning is not a linear journey at all. The work with any organization which has started with a certain vision, the way they were set up, when we want to work with them to completely change the way they had been set up and they had functioned, requires a really complex set of work to be done with them. And in that exercise, envisioning is key. It is very, very important to work with the founders, with people with the board, who actually see what it means to become another organization completely. The envisioning exercise is a very critical piece in that. As you see on this slide, it actually starts off by rewriting their vision statement for the organization. And this is the vision statement that exists as of now. And in this journey, it means that we are working step by step in multiple domains of that organization. If the envisioning is not done strongly, then the organization will not risk making so many shifts in every vertical and every function. So it's really, really important to answer to your question. It also means that the founders are working along with their teams, and so the visioning exercise, the framing of the new vision, the engagement, the communication plan, the structuring of the phasing out from a previous model to a new model, reskilling of team, all of these are very complex pieces. And all of these pieces require strong ownership, and the ownership rests with the founder and with the leaders of the organization. So that's where you start off with, for sure. Thank you. I hope I answered your question correctly.
You absolutely have. And what an interesting concept, and very, very useful. From Sister Celia, we heard loss and how to just deal with that and the process of letting go and that transition. And from you, really clear, the envisioning and being clear about what it would look like. What a fantastic answer. In the chat, Kusum, there's some people asking to connect with you and to think about how they can support their CCIs. So I'd like to encourage yourself and Sister Celia to look at the chat as well. Thank you.
Thank you, Christopher.
Right, we go back to Evelyn in Uganda. Evelyn, can you hear me?
Yes, please. Yes, I can hear you.
Fantastic. So the tripartite, the three-way partnership model you described between government, in-country civil society, and the residential care. Sorry, I beg your pardon, that is not your question. I was wondering. How do you bring donors with you on the transition journey? And what was the most challenging thing for you as an organization?
Thank you, Christopher. Bringing our donors on board, we had to bring them from from step one all the way. And when we are carrying out the assessments, so that they have evidence-based information before a final decision is done. And also, we had to present them with evidence, use experiences, for example, of the young people we work with, let them give their view of how is it like life out of an institution and life outside. So that helped them understand how the transition is benefiting the children and how it is better for children to live in a family setting as compared to living in an institution. And then when we look at our challenges, the legal context of our work was new. There were no foster care guidelines in place. So this was a challenge. Government, I remember when we're involving the government, they asked us, are you sure of what you're doing at the moment? Because there were no proper guidelines concerning foster care. And something else that was also a challenge, bringing the rest of our organizational staff on board was a challenge. People are worried about their jobs, especially the carers. They were worried, are they going to get something to do? So that was also a challenge on our side. Then also when it comes to fundraising, fundraising is usually donors, especially the local donors in Uganda, were accustomed to visiting the baby's home. So once the baby's home was transitioned, it was very difficult for them to keep on board since there were no babies at home. So those were among the challenges we faced as an organization. Thank you very much. Back to you, Christopher.
Thank you very much, Evelyn. Well answered and very, very clear. We now go back to Cambodia and speak to Lo. Some of our questions will be related to actually what Evelyn has said. But I'll start with this question. Lo, can you hear me?
Yes, very well.
Perfect. So the tripartite partnership model you described between government, in-country civil society, and the residential care institution, the RCI, was effective in many cases in enabling transition. However, the report identified one key barrier, and that was the challenge of engaging donors. So I know Evelyn has said a bit about that, but we'd like to hear from you. What impact did donors have on the residential care institution's decision? And how did challenges engaging them affect the transition outcome?
Thank you very much. Again, the good question. I will not turn on my camera as it helps with the sound. Our study found out in reality our key challenges in approaching RCI for transition. And as I have mentioned before, the government and the civil society working together with the care reform, awareness raising promoting family community-based care as well as support to RCI for the transition. However, the effort we have been making is reaching most of the time to the staff and director of the RCI. And many RCI in Cambodia are funded by donor abroad. So it has been quite challenging that this key message awareness reaching to the donor. So there are some key recommendations for us to consider how we can reach out to the donor, and of course there are some already existing practice we have been doing that including key message to major donor, some careless effort to express their experience with different media format. And we, after the report launching, we will figure out together with the government other approach to reach the donor outside of Cambodia, to attract them, provide them clear message of the reform and the strategic plan and the government action plan, and different way they can still contribute to Cambodia, not stopping their funding, but a better option toward the life of the children and family in need of their support, which are family and community-based care, and how we can work together on this. So that's my brief answer. I'm not sure if satisfy you.
No, it does, Lo. Thank you so much. And don't we all know too well the challenges with making sure we bring the donors with us? A conversation and a question I'm often asked about when we start to talk about transitioning. So thank you very much. I want to thank our panelists, but it's not over yet. We do have some questions from you that won't come from me, but come from the people that have joined this. Again, we thank everyone from all the parts of the world that are joining this amazing webinar on transition. You're welcome now to continue putting your answers in the Q&A section. My colleagues are feeding them to me. So if I look down on my phone, please don't think I am distracted. I am simply reading a question. So my first question is for Hannah. Hannah, can you hear me?
Yes, I can. I can hear you.
Fantastic. Hannah, I've been asked to ask you what aspects of the organizational and governance strengthening have been important in transition? And what is your experience of supporting residential care institutions who didn't have strong governance and leadership in place and without donor support?
Okay, that's a lot of questions. Let's see, no donor support. Okay, so I'll start with the organizational governance. So with that one, I think, I mean, it's hard to pick out which ones are the most important. If you start with developing a baseline, trying to understand what's your starting point, that could look like an organization that has absolutely nothing in place. So they might not have any funding agreements between the donor and the institution. There might not be any policies. There might not even be staff employment contracts, things like that. And so if that's the starting point, then that, especially in the transition assessment tool, that will guide you towards putting those things into place. In terms of what you, what the challenges might be if you don't have the donor support, I think that depends a lot, again, on, you know, the starting point of the institution. So, you know, what is the, I guess, the desire to transition from the director and the other stakeholders if the donor is not involved. So if it's just the director that's interested and kind of self-initiating a transition, then I think bringing the donor along on a journey once the director is on board can be a two-step process. Whereas if you have a director that is really not interested in transition and you also don't have the support of the donor, then it can be a very risky situation to enter into. In our experience at ACCI, we typically have worked with donor-led transitions, meaning that it's the donor that has identified that they would like to pursue transition with the home that they support. And so in that case, it kind of flips the power dynamics because you've got somebody who's controlling the funding that's coming into an institution, and they can often hold a lot of influence. So I think, again, it just depends a lot on what your starting point is. And then bringing it back to the transition assessment tool, that tool is designed to help you work out what is your starting point, where are the key levels of influence or the levers you can pull to shape the transition into a way that will be less harmful for children and have positive outcomes.
Fantastic, really clear, very detailed as well. And I think very relevant to some of the biggest challenges people experience around transitioning, particularly without the support of the donor. Big questions. So folks, I want to remind you at this point, I'm going to ask a few more questions, that for all of those asking to connect, to ask more and to kind of link with us, we will encourage you to join the platform. The platform will give you an opportunity to connect with others, to have these discussions, and to freely access the support we need. So I'll come back and highlight how, and make sure that we all know that. So do not feel left behind. The fact that you're here, you're already part of the conversation and discussion, and you can join the platform to access each and every one of the people speaking today. My next question is for Evelyn. Evelyn, can you hear me?
Yes, please.
Fantastic. Evelyn, is there a role for emergency foster care in transition in your experience?
I would say yes, there is a role for the emergency foster carer, because usually they are agreeing to do something that they have not done before. And just imagine you're bringing in a child who has been just abandoned into your home. So yeah, we carry out assessments to understand why they want to take this on. And we also carry out trainings for them to understand what they are doing and what they are getting into, and what are the pros, what are the cons, and so that they understand that this is something that is critical, but it's for the best interest of the child, because we have seen children thrive more in a family setting. We have seen children meet their developmental milestones better in a family setting. So yes, there is a role for an emergency foster parent. I don't know if I've answered that right.
No, thank you very much, Evelyn. You have answered it. And I will encourage all those who want to hear more from you and learn more from you to join the platform, and particularly the working group. My colleagues have posted a link to that, folks, on the chat group. So please click on that link and please join us. Right, so I have a last question here for Rebecca. Rebecca, can you hear me?
I can.
Excellent. Right. So my question for you is a simple one. Have there been scenarios where the donors differed from founders and pulled out their support for transition? How was this handled, or how have you heard this has been handled?
Yeah, absolutely. That certainly does happen. And it can look like two different scenarios. Sometimes the director and the board may decide to transition, but the donor doesn't agree with that change to the model. And so they may cease funding, at which point the organization is left in the position of trying to secure alternate funding to continue to implement their transition. In my experience, that is less common than the alternate, which is that the donor may be the one that is really wanting to pursue a transition, and they are encouraging their partner to go on that journey of transition and offering support for that. But they might get to a certain point at which point the director and the board may decide that they're not going to progress with transition. And in that situation, sometimes donors will then make a decision to divest of their resources and their investment in their partner residential care service. And so you would have remembered when we looked at the structure of the phases tool, that was really represented by pathway B, where it talks about that divestment process and goes through the steps of what a donor, for example, might need to think about in doing that in a safe manner. So we certainly do see that. And it's common when the donor that is deciding to pull out or to stop supporting that transition. It's common when they're not the main donor, when there might be another donor who provides a more substantial amount of funding, and they're the ones who want to keep the residential care service going. In that case, the donor who wants to transition may not have as much influence and therefore may not be able to persuade their partner to transition. Their partner may choose to align with the larger donor because that's what will provide them with the greatest financial security. And so that's a very, very common scenario, in which case we often then encourage that donor to go through a responsible divestment process and then to look at reinvesting their resources in another family-based care provider or service, or family and community services or programs, so that that investment is retained within the child protection sector, but is directed towards family care. Thank you.
Thank you very much, Rebecca. Thank you so much for that. So folks, I can see that there were some questions, but most of them are being answered by our other colleagues within the chat group. I just want to thank you all, first of all, for sending in your questions, everybody that did through the Q&A section. We really appreciate it. But also we want to thank our panelists, Kusum, Evelyn, Lo, Sister Celia, Hannah, and Rebecca. Now, before I close, I want to remind you all that you can join the Transforming Children's Care Global Collaborative Platform. A link was sent, and I'll ask my colleagues to send that link again. If you have any more questions, if you have anything that you hasn't been explained clearly here today, but you want to hear more, we didn't have a lot of time, please join the platform and you will learn more. A reminder that the recordings from today will be available in Spanish and English. The slides will also be shared, and I know that some people asked for the slides from Sister Celia in English. Those will also be shared. It's been great. Thank you for listening to me and for allowing me to be your host. I don't know if Rebecca has anything to add about our next series before I close.
If I could just very briefly before we close, add my thanks to Christopher's for everyone for joining, and just really encourage you, if you are a practitioner who is working in the field of transition, we would really like to welcome you to join the transition working group in the collaborative platform. You can see the link on the slide there as to where you can go to register. And once you've registered, you can simply request to join the transition working group, and that will put you in direct contact with myself and our co-facilitators, Anju Pun from Forget Me Not in Nepal, and also Suli, who is with Changing the Way We Care in Guatemala. And I really want to bring to your attention that we have a brand new Spanish-speaking subgroup that is now a part of the transition working group. We're very excited about this, about being able to engage more with our Spanish-speaking colleagues working in the field of transition. And so our very first Spanish-speaking group meeting will be happening towards the end of this month, so actually next week. So if you want to join the platform in time for that, we'd love to welcome you to that meeting, where we will be holding bilingual quarterly call, as well as a Spanish-speaking discussion group as a part of that. So please share that also with your networks. And just to give you a little bit more visibility of what else is happening within the transition working group, we also have 2 other subgroups in addition to the main working group, one on leaving care and aftercare, which is looking specifically at the aspect of transition that deals with young people who are preparing to leave care and move into semi-independent or independent living, as well as what aftercare needs that they may have, but also how we as organizations engage young people who are in care in the whole planning, decision-making and implementation processes involved in transition. So there's that working group that is facilitated by 2 of our wonderful care experience expert colleagues, Mai from Uganda and Sinet from Cambodia. And we also have the transition learning subgroup, which is very focused on capturing the learning, the evidence, and the data on transition, so we can build the evidence base to really understand what good practice is, how to promote it, and how to scale it. So again, we'd love to invite you to join if you are a practitioner in this space, and encourage you to sign up for the platform so that you can access that working group. So I'll hand it back to you, Christopher. Thank you.
Thank you very, very much, Rebecca. And thank you to our colleagues at Better Care Network, Margot in the background, Catherine, who made sure we all got together, sent out all the information. We couldn't have done this without you. Once again, thank you to Kusum, to Evelyn, to Lo, Sister Celia, Hannah and Rebecca for your presentations. To every one of you, remember, if we want to go fast, we go alone. But if we want to go farther, we need to go together. Thank you all. Be safe and take care.